You are listening to a conversation with The Cancer Letter. I'm Matthew Ong, Associate Editor of The Cancer Letter, and joining the conversation today is Dr. Nataliia Verovkina, a medical oncologist and research fellow at the National Cancer Institute in Kyiv, Ukraine. It is noon in Kyiv on March 4, 2022, 1 week into Russia's invasion of Ukraine. Dr. Verovkina, thank you so much for taking the time to speak with us.
Hi, Matthew. Thank you very much.
Of course. Yeah, are you currently in Kyiv and are you actively treating patients?
Personally, me, no, but my colleagues currently in Kyiv and try to organize a process of treating patients. Currently in Kyiv, we have 3 oncology hospitals that are delivering oncology services. By yesterday, we could provide some chemotherapy to our patient who left in Kyiv. But we're facing a huge problem simply because a patient has trouble simply get to the hospital because of the military state in Kyiv. But we experience huge problem with delivering drug to the hospital because of the war state in Ukraine. The next big problem is palliative patient who cannot come to the hospital and kept in their home. So this is urgent situation with palliative care for our patients who are in the conflict zone, not only in Kyiv. I can speak from Kyiv, but in other hotspots of Ukraine, I think the situation is much worse. Currently, many refugees overwhelming ways of Ukraine. They try to escape Ukraine all stay for how they can. So now there are many refugees in the western part of Ukraine. People are seeking of homes. So many million people are homeless and left without home. Many people try to escape in neighboring countries such as Slovakia, Hungary, Moldova. Oncology patients try to seek oncology help in neighboring countries. We coordinate our efforts with our European colleagues. The next problem is that absence of medical records for refugees. I mean refugees in European countries. So patients who ask for oncology help, doctors simply don't know what to do with them because there is no medical records. A patient don't know about their treatment because they are patient. The same problem I expect in Ukraine, but it's easier because patient has paper medical documentations and doctors in Ukraine can manage the situation easy. But we facing with problem with drug delivery, even essential drugs also. So I'm talking to you please help Ukrainian nation to stand against Russia, and we do our best to help our oncology patient, and all help is greatly appreciated for all sides. Thank you very much for whole world, and please help us to condemn Russia and stop Russian aggression in Ukraine. Thank you.
Thank you. Can you also describe what kind of scenes are you seeing right now immediately outside your hospital, and can you give me a sense of what your everyday work right now is like at the institute?
In my hospital, in institution, my colleagues who left in Kyiv try to come to hospital. We do chemotherapy. Currently, all planned surgery stopped, but we do our best effort to start this operation again. To urgent surgery is possible. in other Kyiv hospital, children hospital, there are children who requires I'm a bit worried. I'm sorry. Who requires very special care, for example, children who receiving high-dose chemotherapy or bone marrow transplantation. Some children are kept in this hospital, and my colleagues from other hospital also are having troubles to manage this patient. Currently in my hospital, there is no such patient, but situation can change anytime, you know. I think the most issue in Kyiv now is logistic issue to delivery drug and to safety to drug delivery and safety of the patient to come to the hospital.
Got it. Is there a way out of Kyiv for you, your colleagues and patients, if the situation gets worse for the capital city?
Now, patient could be evacuated to safe places in Ukraine, and they can receive all oncology medical help in regional oncology centers. They just have to come to the center and ask for the help. So currently, Ukraine centers that are not in hot spots of the conflict can provide these help. But we are facing with shortage of drugs. I mean, chemotherapy drugs and other essential medication for oncology treatment, or with the curative or palliative treatments. So currently we do what we can, but we don't know for how long our resources. So now we try to estimate drugs that are currently in Ukraine, but the resources are limited, so we are asking for humanitarian help for our oncology patients.
Got it. Yeah, what else do you want audiences in the United States and Europe to pay attention to?
We have some patients, male patients, because of military state of Ukraine, male from 18 to 60 years are not allowed to cross border Ukraine. Some of our patients are men who are undergoing curative treatment, oncology curative treatment. And I think it is the urgent issue to establish the way the patient who need specialized oncology care for curative purpose to develop mechanism to cross Ukrainian border to receive the curative treatment outside Ukraine. This is a good issue. This is the big issue.
Got it. Have your family and relatives moved to safety, or are they planning to?
Currently, my family and my son are on the way to the safer place of Ukraine. We left Kyiv yesterday. Currently, we are in Vinnytsia, and we are traveling to western part of Ukraine. And really, we don't know what will happen with us even in 1 hour. So we are in a big stress, we are threatened, but we will stand for our country. We want to stop Russia bloody invasion, and we demand all the world to help Ukraine stop this bloody and terrible war.
And I really appreciate you even taking the time during this crisis to communicate this. So the World Health Organization also told me that oxygen supplies, even something as basic as that, are being exhausted across most hospitals. Are you seeing that as well?
I cannot, some hospital, yes, I cannot talk about my hospital because currently we don't doing operation. I think situation will change, but I cannot tell you the exact information by this moment. I don't have enough information regarding my hospital.
Got it. Our audience includes more than 250 institutions across the United States and elsewhere in the world. If you could speak directly to them as you are now, what do you want to tell them and how can they send help exactly?
How exactly they can help our oncology patient, yes? We really urgently need medicine for patients who cannot be evacuated from Ukraine, because many patients will not have possibility to cross the Ukrainian border, and this patient will require oncology help in Ukraine. So I think we would need medicines. I think we would need support for professional societies, professional help, maybe consultation, because we will be organizing process of treatment our patient in Ukraine. The situation depends on the region of Ukraine. So medicine, financial, I think financial help, it's most efficient, and our government working on this.
Right, of course. And are all the hospitals in the institutes still in good shape through the war? Are they still able to get access to electricity and water supply so far?
In Kyiv today, yes. In Kyiv for today, all the hospitals in Kyiv are working, and we have electricity and water supplies on time, because our administration working on this and monitoring is closely. In Kyiv, yes. I don't know situation in Kharkiv. I think situation is much worse in Kharkiv, but I am in Kyiv. I was in Kyiv till yesterday. But what will happen next day or next year, we don't know. Our soldiers, our rescue team, all the government and the administration working hard to do their best for efficient work of the medical system. My colleagues working in hospital more than hours, more than days, and some of them left in the working places since February 2004, when this terrible war started. Some doctors in Kyiv experienced trouble to get to the working place because it might be not safe, and there is problem with public transportation, and some doctors are willing but physically are not able to get to the work because there is no no ways to get to the workplace safely. Kyiv experienced huge air attack sirens, so we have to hiding in the shelter whenever we are at home, at workplace, and it's terrible. I think it's terrible terror for all of us. So in days, at nights, we have to sleep in shelter. Sometimes we have to spend many times in shelter, and and my colleagues provide medical care for the patient in shelter. But there are some patients who cannot be evacuated in shelter. So we cannot stop operation when the air siren starts. though the doctors operating even under air strikes, air sirens, and they do not stop in urgent operation. So this all my colleagues working harder than they can. So we do all our best to stop this nightmare.
Got it.
And there is some patient in the intensive care unit which are also hard to evacuate to the shelter. So they experience a huge problem with this. Not only oncology, but other patients also.
If there's a chance for this conversation and this video to reach any Russian audiences, do you have a message that you would like to share with them?
Yes, especially Russian. I want to talk to my Russian colleagues. Dear Russian doctors, please go to the protest. Stop this bloody war, because it threatens not Ukraine, it's threatening all the world, it's threatening patients that we are treating together, because our patient, the same as Russian patient, and currently we cannot provide them with essential medical care. Please go to the protest, stop Putin, stop this war, because it's threatening whole the world, and you also.
Thank you so much for taking the time, and I wish you a safe journey for you and your colleagues and your patients, and most importantly, your loved ones and your family. Thank you so much.
Thank you. Thank you. Let's work here as Ukrainians.